My name is Samantha, and I'm going to tell you about the chronically ill as a vulnerable population. Chronic illness is represented with this picture. There is so much more to the story than we realize. Chronically ill are vulnerable for many reasons. Their health status may limit their mobility and thus limit their income status. Financial challenges due to healthcare costs, and they also have barriers to adequate health care. Those with chronic illness have emotional vulnerability. They face abandonment, social isolation, powerlessness, depression, grief related to loss, frustration, and stress and anxiety. Those who have a chronic illness may have limitations due to pain. They have to deal with the impact of disability on activities of daily living, and dealing with limitations due to loss of function. You may be asking yourself, what is a chronic disease? According to the Center for Managing Chronic Disease is a long-lasting condition that can be controlled but not cured. According to the Center for Disease Control and Prevention, chronic diseases and conditions such as heart disease, stroke, cancer, diabetes, obesity, and arthritis are among the most common, costly, and preventable of all diseases. As of 2012, about half of all adults, 117 million people, have one or more chronic health condition. According to the World Health Organization, over half of all deaths worldwide are from chronic diseases. Those with chronic illness are vulnerable due to self-blame. They may feel guilt due to the lifestyle choices that they have made. Those that are chronically ill have barriers to health information. According to a study published in Practice Nursing, patients report wanting additional information from their healthcare providers than they receive. Those with chronic illness are vulnerable from a health perspective. According to an article in Health Affairs, individuals that have a chronic illness have difficulty finding effective health care. This may be due to the fact that our healthcare delivery system is set up to deliver acute care rather than chronic care. Those with a chronic illness are faced with a multitude of problems. Often they have to see more than one doctor in order to manage their chronic illness. This often leads to conflicting advice, which adds to their overall stress of managing their illness. Many burdens accompany chronic illness. Medication burden due to the use of having to take many different drugs and dealing with the possible side effects of their use. Financial burden and the constant worry about costs in relation to healthcare. Time and travel burden, which refers to the extensive time it takes to manage chronic illness. Healthcare access burden, which includes challenges to finding proper treatment. 1 out of 4 adults has 2 or more chronic health conditions, which adds to the challenge of managing a chronic illness. Current healthcare does not meet the needs of these patients, forcing them to see many healthcare providers to obtain the treatment they need. Those who have chronic illness are vulnerable to depression. Research has indicated that those who have poor health are at risk for depression. For those suffering with the chronic illness, they face many challenges that they have to overcome. As a society, we have to remember the picture of the iceberg and try to be part of the solution, not the problem.